Good morning and welcome to the Rural Community Action Assembly on recovery-friendly workplaces for workforce development. We are ecstatic that you all are able to join today. My name is Philip Jones and I am a Community Engagement Associate at the Federal Reserve Bank of Philadelphia. This meeting is the second of 3 Rural Community Action Assemblies we will be having this year. This series began in 2020 and focuses on actionable research and programmatic models to promote strong and equitable workforce and community economic development in rural Pennsylvania. I'd like to take a moment to thank our partners at Penn State Center for Community and Economic Development. They have been amazing partners in the planning and convening of our speakers today, and we are truly appreciate their continued support in helping make events such as this a reality. We've heard from stakeholders in rural communities that finding innovative ways to attract and, more importantly, retain a workforce is a top priority when considering workforce development issues. We are excited to learn from leading experts on research, initiatives, and programming to better understand how communities can equip themselves with the knowledge and resources to support historically stigmatized cohorts in the workforce. Next slide, please. Before we start today, I'd like to go over just a few guidelines and some general virtual housekeeping tips to ensure that our meeting today is as informative as possible. First, the information, analysis, and conclusions set forth are those of the presenters and do not necessarily reflect the views of the Federal Reserve Bank of Philadelphia or the Federal Reserve System. Please share your name and organization so that the panelists and audience members can see who is participating. Please, if possible, log in with your video enabled and be prepared to use the Q&A box to ask questions or to offer comments. You will have the option to submit your questions or comments anonymously as well. Next slide, please. Be sure to mute your mic when you're not speaking. If there is noise coming from your location and you are not speaking, your mic will be placed on mute. Also of note, today's assembly will be recorded. The presentations will be shared with slides after the assembly. Finally, a survey evaluation will be available after the assembly. We ask that you share your thoughts and comments about today's presentation to inform future ones. Next slide, please. Today, our panelists will provide a brief presentation to share their expertise. After every presentation, there will be a very brief opportunity for speakers to answer 1 and possibly 2 questions. The presentation will then be followed by a group of discussions where we encourage you all to participate and pose questions in the Q&A box. Next slide. And now, I'd like to introduce our moderator, Lisa Davis. Lisa is the director of the PA Office of Rural Health. She leads a group that is exclusively devoted to increasing the access of health services in rural areas. The Office of Rural Health has a very broad mandate, which allows them to uniquely serve the needs and the state, ranging from providing technical assistance to small rural hospitals and health clinics to capacity building initiatives that assist in the recruitment and retention of healthcare providers in rural communities. Lisa Davis ensures that the Pennsylvania Office of Rural Health exceeds its mission of being a source of networking, coordination, and technical assistance to advance rural health care delivery. On national, state, and university levels, she serves on a wide range of boards of directors, advisory committees, and task force focused on rural health policy, rural health research, economic development, outreach and education, and vulnerable populations. Lisa, thank you so much for being here today and moderating this relevant and important conversation. I will pass the baton to you.
Thanks, Philip. It's my absolute pleasure to serve as the moderator for this webinar. In the field in which I work of healthcare, workforce challenges have been the predominant issue. But interestingly enough, that has actually changed a little bit because now the top issue in rural communities competing with workforce issues is addressing substance use disorder. Those in recovery from substance use disorder can be among the most reliable and dedicated employees. In choosing recovery from addiction, they have shown the resolve to work toward or become substance-free and have demonstrated a commitment to address struggles, identify problems, and develop strategies to move toward a life based on self-determination and independence. The path of sobriety is not linear. It requires a daily commitment to a substance-free life and to forming and sustaining new patterns of associations and responses to the pressures of living in the 21st century. The person in recovery may be facing new commitments to family, community, and employment, and may be easily overwhelmed and struggle with staying away from old habits. In short, it is hard to be sober every day. Employers can create recovery-ready workplaces that focus simultaneously on the goals of the company and the ever-evolving needs of employees. State government, chambers of commerce, or local community-based organizations may have recovery-ready and recovery-friendly workplace initiatives or may offer resources to develop those skills and policies. Employers also can establish partnerships with local treatment providers, recovery community organizations, recovery residences, and social service providers that can support new hires in recovery and employees returning to the workplace following treatment. Our panel of experts will focus on the convergence of workforce and substance use and will provide insights into how a resilient rural workforce can benefit from the full inclusion of all community residents. This will be a great program, and we are so glad that you're able to join us. So I'm very pleased to introduce our first speaker. Dr. Christina Brandt is an assistant professor of rural sociology and a co-funded faculty member with Penn State's Consortium of Substance Use and Addiction. Dr. Brandt conducts research in the general areas of rural health, rural poverty, and rural policy, and much of her work focuses on the experiences of rural residents who use drugs and the impact of substance use and overdose on rural communities. As a qualitative researcher, she uses in-depth interviewing and ethnographic methods to evaluate lived experience and draw patterns across people's narratives. And as a community-engaged researcher, she aims to partner with community organizations to conduct work that directly informs practice. Dr. Brandt also holds an appointment with Penn State Extension, where she uses her research to inform community-based programming in Pennsylvania communities. During her presentation, Dr. Brandt will draw on her primary work, where she did research in rural Kentucky using qualitative methods. Using primary stories, Dr. Brandt will focus on the current strategies that people in recovery face, and how she was able to ascertain the impact of substance use stigma in rural communities. As you listen to the presentation, please give thought as to the questions that you would like to ask Dr. Brandt, either now or at the end of all of the presentations. And please put those in the Q&A link that you'll find at the bottom of the screen. So Dr. Brandt, I will turn things over to you. Thank you so much.
Great. Thank you for the introduction. I'm excited to be kicking things off here for us. So you can click the next slide, please. My goal is to begin with a really broad overview of the U.S. opioid crisis. I'm going to discuss why stable and fulfilling employment is crucial for recovery, but I'll also show why accessing stable and fulfilling employment can be particularly difficult for people in recovery, and especially those who are early in recovery. And finally, I'll make a quick case for why focusing on employment is essential for supporting people in recovery. Next slide. All right, the opioid crisis can be traced to the early 2000s when providers started prescribing opioids at increasing rates. And many patients who were overprescribed opioids developed an opioid use disorder themselves, but the spread of prescription opioids into communities also meant that the supply of drugs that were available for illegal use had increased as well. So providers tried to rein prescriptions in, but at this time, by the mid-2000s, opioid use disorder was already widespread, and people were compelled to turn to more accessible but usually more dangerous alternatives. And so in the 2010s, as we had started to see prescription numbers falling, we saw a drastic uptick in heroin use. And then in the mid to late 2010s, we saw the introduction of illicitly manufactured fentanyl, which is a synthetic opioid that's both more potent and more dangerous than heroin. And as more and more of the opioid supply became mixed with fentanyl, overdoses and overdose deaths skyrocketed. So these three waves of the opioid crisis progressed, and we saw opioid overdoses increase by over 500%. The number reached a peak last year at 83,000. Next slide. Overdose is related to opioid use disorder because those with a disorder are often likely to use more and use more often. So one way to reduce overdoses then is to create pathways to recovery. So 83,000 annual deaths is a really huge number, but a focus on overdose numbers masks the far greater population of people in the US who have an opioid use disorder. So our best estimates currently suggest that between 6.7 to 7.6 million US adults are currently living with an opioid use disorder. Recovery requires building or rebuilding a healthy and meaningful life. And research shows that success in recovery often requires putting together many different pieces to create such a life. That can include a place to live, social connection, a stable income. And importantly, the path to recovery is going to look different for different people, but often many people who are seeking recovery have the goal of achieving stable and meaningful employment as one of those pieces. And indeed, research does show that unemployment is a risk factor for developing a substance use disorder. And then conversely, attaining stable employment will lead to lower chances of relapse and higher chances of sustaining recovery. Next slide. Throughout my research career, I've done hundreds of interviews with people with substance use disorders and people who work in substance use services. And I've done this both in Kentucky, as Lisa mentioned, but also here in Pennsylvania. And many of the folks I've met have underscored this point on the importance of employment. So I met Megan, for example, in the midst of the pandemic. And the year before I met Megan, she'd received a felony drug possession charge. She had received probation with the condition to attend inpatient treatment. So she went to treatment, she finished, she came home and was doing well. But the loss of her job, she felt, had led her to relapse, and her probation was revoked. So she told me everything was good. I was a full-time dog groomer. I had a full-time job to come home to. Everything was great. COVID took my job, and boom, you get bored, boom. This COVID messed a lot of things up. I would have been okay if I hadn't lost my job. I would have stayed busy and stayed on track. I wouldn't have ended up back in jail. Next slide. So Megan felt that her job provided her the stability to maintain recovery when she left treatment, and losing that job meant she lost that stability she really felt that she needed. So I also met Nick days after he had left inpatient treatment. He'd completed programs several times before, but had never sustained recovery afterward. And he repeated what Megan attested to, feeling that securing a job quickly would help him succeed. He told me, 42 years, half my life I've been in this struggle, half my life, and I'm not struggling no more. I ain't struggling no more. We got a nice place, got a vehicle. I just left this rehab over here. So the main thing is just to get a job real quick, because I don't want no free time. I need to be doing something, be around good people. That's the main thing for me. Next slide. So nonetheless, there are several barriers which people in recovery will come up against in trying to attain and maintain that stable employment that they desire. And one barrier in attaining employment is the mark of a criminal record. So Megan, for example, the woman I just introduced, she began applying for jobs immediately after she was discharged from jail. But the first two jobs she applied for explicitly stated that they wouldn't be hiring her due to her recent felony conviction. She told me, people who get out of jail, people who have completed rehab, or even if they haven't, there needs to be something. We're trying. I got turned down for 2 jobs. It's just stupid. We shouldn't be just a piece of paper. You know what I mean? There should be more opportunities for people to have the option to help themselves when they're trying. So Megan had obtained her first job as a dog groomer after treatment through a family connection, but she ended up burning that connection when her probation was revoked. And when she was leaving jail, no one had helped her plan a future. When she came out, she was struggling to find even a minimum wage job with her felony status. Next slide. Some of the women I've met also underscore that this challenge poses a particular burden on women. So Vanessa was a woman early in recovery, and she told me how jobs that are unlikely to make decisions based on a criminal record tend to be those in manual labor. And certainly women can work in those male-dominated fields, but some women may not be able to, women may not want to. And so Vanessa told me, I definitely feel like it's easier for men because they have that ability to be a laborer or something like that. And those jobs don't often care about a background. background. As far as women, if you're trying to go into anything with sales or anything that requires licensure, that all matters. You have to have a clean background. So it makes things so incredibly difficult. Next slide. Having the mark of a criminal record alone is not the only way the justice system can inhibit employment outcomes. So Regina recalled that her early days in recovery felt fragile because she struggled to maintain employment. She actually had the opportunity to attend treatment court, or sometimes called drug court, in lieu of incarceration. But treatment court is quite intensive. It can require attending weekly court sessions, random drug screenings throughout the week, among other things. And Regina recalled, it was difficult to find a job with a lot of different rules and regulations for drug court, not being able to be out past curfew, having drug tests every morning, court every Thursday, meeting with your probation officer every week. We weren't allowed to eat, shop, or work anywhere where alcohol was sold or served. That was very narrow as far as where we could work. It just felt hopeless. Next slide. Parents in early recovery also might have open cases with Child Protective Services, even if they never were involved with the criminal justice system. And CPS involvement entails the similar time-intensive and unpredictable requirements that can make maintaining traditional employment difficult. So Kim teaches parenting classes that CPS-involved parents often take as part of their case plans. And she posed to me this question. She said, could you do it? Would your employer allow you to do it? Because we're asking them for 3, 4, 5 days a week drug tests on a whim. Sorry, Cracker Barrel's not going to let me leave in the middle of a lunch rush to go get a drug test. So you've set me up to fail, because if I don't get the drug test, I have to start all over. But if I lose my job, that's a penalty against me too. Next slide. Seeking treatment in self can also make maintaining employment difficult. For people who use medications for opioid use disorder, particularly methadone, seeking treatment can be time intensive. People early in recovery might have to visit clinic even daily, and clinics' open hours can be very limited. Clinics also might require counseling for multiple hours, multiple times a week in order to get your medication. So Mindy, a woman in recovery, has utilized multiple clinics to obtain her maintenance meds. And she explained this to me. She said, they're all different. Some you have to do IOP, intensive outpatient treatment, which you first walk in the door and you have to step down from IOP. You have to do 3 3-hour groups a week. You can't even live any normal life and have a job if you have to do all that. They say your recovery is supposed to be the most important thing. Well, you've got to pay bills. Next slide. And finally, while the mark of a criminal record is certainly a form of stigma, people in recovery face the additional stigma of past substance use. This stigma can impact folks' ability to obtain employment, and it's especially pronounced in rural areas where community members are more likely to know of one another's pasts. So one school official, Bill, had told me of a personal connection who'd recently completed treatment and was struggling to find employment in their town. He told me, he never had any felonies or anything, but everybody in the area knew he had an addiction issue. He was cleaned up and we wanted to get him back to work. He would have been a great asset as a football coach and a lot of other things for our district. It didn't work out, because when we hired him to substitute, we were bombarded with calls. He never got a chance to do a good job, to be honest, because it was complaint after complaint. All right, next slide. So the combined impact of these barriers is that people might become confined to low-wage or part-time employment, or they might cycle in and out of short-term employment that they just can't sustain. So one treatment court lamented the struggles he faces trying to help his participants overcome these employment hurdles. And he said, what are these people graduating to do? I represent these folks and they're coming in. Well, how are you doing with your life? Well, I got a job yesterday. I'm working at Burger King, but they're only giving me 20 hours a week. They're taking $150 out of my check for child support, and I'm coming home $200 every 2 weeks. I'm getting $400, but my rent is $550. I'm only able to survive because I'm getting a voucher through drug court to pay half that rent. So Judge Richardson felt that this continued cycle of treatment and incarceration was inevitable. His participants were given an opportunity to rebuild a life through treatment court, but they weren't structurally given the tools to do so. And he found that recovery was nearly impossible to maintain without these legitimate possibilities to secure employment, become financially stable, find a purpose. And he told me he thought if he faced the circumstances of his participants, he would likely relapse himself. So I ask, is it possible to give people in recovery these tools to succeed? I listed a number of barriers that folks face attaining and maintaining employment. So the mark of a criminal record and stigma will impact people's abilities to find employment. And then often the requirements of criminal justice involvement, child welfare involvement, even treatment can be incongruent to the expectations that employers hold. But certainly employers could work with employees both to meet these requirements and to help them succeed in a position. But this requires an intimate understanding of the systems that people in early recovery are having to navigate, and a commitment to investing in people's futures. So helping employers learn to do this, creating the policies and procedures to help people in recovery thrive. That's the mission that we're discussing today. That's the mission behind recovery-friendly workplaces. Thank you. I'm happy to answer any questions now or when we do the full Q&A later.
Dr. Brand, thank you so very much. At the moment, I don't see anything in the Q&A, and I just want to make one quick comment, and then I think we'll introduce our next speaker. But it seems to me as if this is a systemic issue that runs through so many components of communities, employers, and other systems that are essentially unmovable. Right? Probation, drug court, so on. And perhaps when we get to the end, we'll be able to talk about how we can impact that systemic change that might need to happen. So thank you so much for your presentation.
Thank you.
It's now my distinct honor to introduce Dr. Glenn Sterner, who is an assistant professor of criminal justice at the Penn State Abington campus. As an expert on substance use issues, he is an appointed member of the Opioid Overdose Task Force for the state of Pennsylvania. He is also a founding member of the Penn State Consortium on Substance Use and Addictions Advisory Board, and he co-chairs the Substance Use Stigma Reduction Collaborative. Dr. Sterner's primary research agenda focuses on understanding issues at the intersection of community safety and public health, specifically in the realms of substance use, human trafficking, and gambling issues. He was a lead member of the team that assisted the Pennsylvania Office of the Attorney General to develop the method for distributing the 2022 opioid settlement funding, and he now coordinates the efforts to measure the impacts of these funds within Pennsylvania, otherwise known as Elevate Pennsylvania. So, Dr. Sterner, I will turn things over to you. Thank you so much.
Lisa, thanks for that introduction, and I'm really honored to be here today. What I want to talk about is building on Dr. Brandt's previous discussion around the barriers that individuals who are both active in their recovery as well as active in their use, and as they move into the workforce that they face. And so I want to give you a picture of who those people might be as they start to apply for positions within your companies, within your communities, and more so, how it is that we can think about developing an ecosystem to support recovery, but also addressing all types of substance use issues. And so this provides us a little bit of an understanding of those individuals' histories attached to their substance use patterns. And so while, yes, we are in an opioid crisis, I like to consider it an overdose crisis because as these numbers indicate that there are more than just opioids that are being utilized by individuals who are active in their use patterns. We've actually seen an increase in cocaine use and psychostimulants. And so those individuals who might be coming to your companies might have more than simply an opioid use issue in their past, and might be facing more complex issues as they start to think about their recovery moving forward. Next slide. And while it is important that we understand overdose deaths and substance use more broadly, we want to make sure that we recognize that there are different populations that this public health issue affects. Both men and women are affected by overdose as well as substance use related issues. Men typically are more associated with use, but women are increasing over the past several years in their use patterns as well. So make sure that we're thinking about this in a holistic framework as we start to look at our potential employees. Next slide. And as we are all keenly aware that this affects communities all across our types of communities, whether that's urban to rural. And actually in rural communities, we see that overdose deaths are more prevalent among women than men. And so it might be something that you might see more individuals who are associated with substance use issues within female populations if you are located within a rural area, something that might surprise you. Next slide. We're also keenly aware that the types of individuals who are being affected by the overdose crisis is changing. And so we have actually seen an increase, a marked increase in overdose deaths among individuals who identify as non-Hispanic American Indian or Alaska Native, non-Hispanic Black, as well as Hispanic populations. And those increases have been more marked for those populations than white populations over the past several years. Because as we know, overdose deaths are unfortunately increasing across all populations for the past year. Next slide. And as Christina had mentioned before, we know that those who are justice involved are also heavily associated with substance use. And we note that within the United States prison population, that roughly 65% with an active substance use disorder of any type. And so as they are moving back into our communities, back into recovery, and again, back into the workforce, likely this intersection is going to be something that we're going to need to focus in on and find ways to support and address. Next slide. And so, as Lisa had mentioned, I've been involved in working on this opioid settlement funding. And for those of you who are not aware, in 2022, 4 companies, Janssen, AmerisourceBergen, Cardinal Health, and McKesson, settled with 46 states in the District of Columbia in order to identify and meet the responsibilities attached to their role in the opioid crisis across the country. That means that funds are going to be going across all of those states and in various waves for the next 18 years. And that's a lot of money that's going to go into the communities to help to address the issues that are being presented across substance use related issues, but also, frankly, as they think about developing that ecosystem into a recovery-friendly community that can help to support and hopefully prevent substance use-related issues now and into the future. And this is where you come into play. As we think about the state of Pennsylvania, most of those funds are going into our local communities, but that differs across our multiple states. And so as you think about the use of these settlement funds across the Commonwealth of Pennsylvania, but also across the entire country, each county, each community is at an inflection point. This is an opportunity for us to really think about what have we done in the past, what are we doing now, and what do we want to do in the future in order to address both substance use prevention, treatment for those facing substance use disorder, as well as developing that ecosystem for supporting those who are in recovery so that they can lead happy, healthy lives and increase the health and safety of all of our communities across the country. Next slide, please. And so in order for us to be able to do so here in Pennsylvania, we've started what we call the Elevate Pennsylvania Initiative. And this is a way for us to find ways to understand what's working, share that knowledge across communities and counties within Pennsylvania, and then again, make sure that we're maximizing the use of these funds to develop that ecosystem of support for substance use related issues in the Commonwealth. And this is where you come in. You have the ability to work with local task forces that are helping to decide the use of these funds, whether that's within your county commissioners' offices or whether that is within commissions that are addressing overdose at the county or even the community level. This is where you can have your voice seen and heard and help others understand the needs for supporting recovery-friendly workplaces across our communities within the United States. And in order for us to do so, we need to make sure that we are thinking about what that really entails. What is an ecosystem that supports recovery, and what, frankly, does that mean for us moving forward with regards to the workforce? And I've already shared with you some of the important information and the data of those who have unfortunately passed away from overdose. But we know that roughly 29 million people in the United States, according to our best estimates from the Substance Abuse and Mental Health Administration, Services Administration, within 2021 are in recovery. So for all of those that we continue to lose, unfortunately, there are many, many more that move into the workforce, move back into the workforce, and frankly, are then going to need to make sure that we have a community, an ecosystem that can support their recovery over time. Unfortunately, we know that substance use disorder is a health condition that never goes away. Once you are in recovery, you are always in recovery. And so we need to make sure that we continue to support those individuals over time. And luckily, we have a presentation that's going to follow directly about how it is that we can develop those systems of support in order to make sure that those individuals who are facing recovery in our communities over time can, again, develop that capital in order to achieve that healthy, happy, productive lifestyle over time. Next slide, please. Because recovery and that process is possible. And I'd like to just introduce you to the opioid, the Story Powered Initiative that helps to understand those who've been affected by substance use disorder, among other stigmatized conditions. And this individual pictured here is Michael DeMaio. He's a person who is in long-term recovery, who suffered with active use for several decades, went in and out of recovery processes and treatment experiences, but now has been in long-term recovery for many years, is now a graduate of Villanova University, and he is helping others to understand the importance of recovery and recovery-friendly workplaces as he's now moving into the workforce based on some of the capital that he's been able to gather through community support, both at his institution, but in Bucks County here in Pennsylvania. And so much like Michael, there are individuals across all of your communities that are seeking that type of support. So making sure that you're connecting with those local resources, developing that local ecosystem of support for those who are in treatment, moving into recovery, and then again, moving into our workforce is going to be a critical component of making sure that the opioid crisis subsides, that we make sure that we support those as they move into their process of long-term recovery now and hopefully many years into the future. And with that, I will take any questions.
Dr. Sterner, thank you so much. And I do want to say thank you for the work that you've done at the state level and to ensuring that rural communities receive the support that they need. So thank you very much for that. We've gotten some really good questions in the Q&A, and I think what we will do at this point is save them for a bit because we want to make sure we can have a really robust discussion at the end of our presentations. If you will look into the chat, you will see that Philip has posted some information with links to some of the issues that have been discussed and to other resources. So I encourage you to both post your questions in the Q&A and also in the chat. So I think at this point, I will turn to our next speaker, who is Denise Continenza. She is a food, families, and health educator with Penn State Extension, and she's based in Lehigh County. She has been an extension educator for 22 years, so she has quite a bit of experience. She delivers community education on topics related to family well-being, such as parenting, mental wellness, and financial literacy. She also coordinates the Communities That Care prevention education models in several communities. She serves as the leader for the Extension Substance Use Education Subteam, which uses research and science to educate the public on addiction, recovery, and mental health. And she is also a certified mental health first aid instructor. And so as you listen to her presentation, please consider questions that you would like to ask, both either after the presentation, if we have some time, or at the end when we begin to really delve into some of these topics in a little bit more detail. So, Ms. Continenza, I will turn things over to you. Thank you so much.
Thank you, Lisa. So the mission of Extension is to translate the research that's conducted at Penn State as well as the other land-grant universities and turn that information into useful, practical tools for people to use in their everyday lives and improve the quality of the lives for their families, their communities, and their businesses. So I work closely with Dr. Brandt and Dr. Sterner to address this whole issue of recovery. One of the projects that I'm involved with is the Substance Use Education Subteam. And this was developed back in 2018 when we were hearing a lot about the need for extension to address the issue of the impacts of the opioid crisis. We were hearing this from state and local legislators, as well as from the Extension Council on Policy, better known as ECOP. extensions were being asked to look at their capacity to address this issue. So at Penn State Extension, we decided to start at home. We set up some focus groups and did surveys and interviews with our own staff to see what they knew about the opioid crisis and how they might have been impacted. And we weren't really surprised, but pretty much there was no one that was untouched by the opioid crisis, be it in their homes, in their communities, personally, or in families. And we knew that that was where we were going to start. So we started with some education for our own staff on what is addiction, what do people need to recover? How can we support people in recovery? How does the brain heal from addiction? And we tapped into some of the best experts in the field to provide professional development. And we made sure that our staff was aware of the resources and benefits available to them as they foster their own recovery or that of a family member. And then in 2002, we opened up our educational programs to the public as well as our staff to continue this education and increased awareness, how to reduce stigma, how to help someone come back or support them through recovery. And it was through a training by my colleague, Dr. Alex Elswick from the University of Kentucky, where he is an assistant professor on substance use prevention and recovery, that we became familiar with the concept of recovery capital. This was a phrase that was kind of foreign to all of us, but it's the name given to the conditions in a person's life that support recovery from addiction. But it's often these exact things that people need in recovery that are taken away by our current systems, practices, and policies. So this diagram, and I'm going to preface this with all these slides are being used with permission from Dr. Elswick, who was actually really happy that we were promoting his work. On the left, this probably looks kind of familiar to you. It's Maslow's hierarchy of needs. And, his theory was that in order for people to develop and become fully actualized and reach their full potential, you need certain things in place. It's like a building block where you build this pyramid. So our physical needs, we need to have food, we need to have shelter, we need to have income, we need the security of a safe environment, we need to have relationships, and we need all those things before we can actually be the best version of ourselves. Fully actualized, I think is his phrase. Just a little, I'll take a little aside from that. On the other side, we see the things that are called recovery capital. These are the things people need. These are things that all of us need. This isn't just what people in recovery need. It's what every human being needs. But when we're looking at recovery, these things really need to be present. So looking at all of those things, on the far right, you see family and community connection. That's social recovery capital. We need to have connections with humans that help us to develop, make us feel whole, make us feel a sense of belonging. We need personal recovery capital, which is those basic human needs: housing, health, employment, health care, access to resources. And then on the left, we see the collective recovery capital, which is that, I think Glenn used the word ecosystem. We need a culture of a community that says we support recovery. We need to be surrounded by people and systems that support recovery. So that's how recovery capital is the description of a community or a culture of all the needs being met for someone who is in recovery. So next slide, please. So how does recovery capital work? Well, it makes sense. If we have recovery capital in place, someone is able to go into remission or recovery. And the things that cause them psychosocial stress are greatly reduced. When you think about it, if someone loses their job, it creates stress for them, as we've heard in several of Dr. Brandt's stories, and they're more likely to relapse rather than go into remission or recovery. So the more of the recovery capital that are present, the more likely someone's going to have those stressors reduced in their lives. They're going to feel those connections to positive things, and they're going to be able to go into recovery. Next slide, please. But the problem is that in our society, we really have it all upside down. We expect people to have all these things in place before we will give them a chance to have their physiological needs or their safety needs addressed. So often people lose their jobs when they get a conviction, or they can't get a job. And we heard all the stories, thanks to Dr. Brandt, where we really have this diagram upside down. And we need to think about reversing that. We need to think about giving people opportunities to have those basic needs met through employment, through providing health care and access to insurance and the things that they need. So in Extension, we got talking about how do we help turn this? How do we help flip this? And we began looking at our Extension programs and realizing that many, if not most of them, help build these social capital conditions. Many Extension programs provide the opportunity to learn a new skill. When you think about the making new connections, positive, healthy connections, moving into newer and healthier social circles, being able to develop a skill through an Extension program that might lead to employment. Learning healthy ways of lifestyles like healthy cooking for one, or maybe an exercise program, all those things that help build one's basic needs so they can become healthy again. So we've actually, and Phil just posted it in the chat box, created a resource that we've been promoting to the recovery community that connects Extension programs to Recovery Capital and says, hey, Extension is a resource for your clientele because we can help build this recovery capital in their lives. So our team members are working hard and with our marketing folks to get this information out. So seeing Extension as a resource for the recovery community, which we hope will lead to, and I don't want to take away Doug Swanson's thunder, but the next topic that we're going to be talking about is recovery-friendly workplaces. And this is a role that, we see Extension fulfilling, being part of a greater coalition, bringing these science and research-based programs to bear on recovery. So if there's any questions, I'd be glad to answer them now. And if not, I encourage you to download the Recovery Capital Flyer. Many of our programs are virtual, so regardless of where you're at, folks can tap into them. And if you're from another state, please connect with your Extension in your state to see what they are offering. So thank you very much. And if there's any questions.
Thank you so much. We've had some great questions in the chat, and I think it takes folks probably a minute to be able to develop their questions and then put it in the chat. In the Q&A. But I do encourage all of you to look in the chat because Philip has put some great information in here, especially the materials that were just talked about, as well as the contact information for each of the speakers. So now I think we will turn things to Dr. Doug Swanson, who joined the University of Missouri in 2017, expecting to spend much of his time working on the growing worker shortage. He identifies as a recovery worker advocate after spending over a quarter of a century working for labor unions. The lens he sees life through is that of workers and how issues impact the workforce. The issue of stigma and its impact of the workforce was not an issue that he went looking for. It found him through community conversations where he listened to challenge workers and employers are facing today. In addition to being a field specialist in labor and workforce development for the University of Missouri Extension, Dr. Swanson coordinates and is teaching faculty for the Labor Studies Certificate Program at the University of Missouri, St. Louis. And as you listen to his presentation, which is a perfect follow-up to our previous presentation, please give thought as to the questions that you would like to pose in the Q&A so that we can discuss those as we move forward with that section of the webinar. So Dr. Swanson, I will turn things over to you. Thank you so much.
Thank you, Lisa, and thank you all for staying with us to this point in the program. I am really honored to be with everybody here today. Please, next slide. Actually, we can skip that slide. And as Lisa said, I spent over a quarter of a century working for labor unions. Throughout that time, access to a ready supply of available workers was always a problem. The shortage of workers we're experiencing now has been exacerbated. It has grown, but it was forecast as far back as the 1990s. COVID didn't cause it. It's going to get worse. And so we have to do something different. It's not just due to baby boomers retiring either. Next slide, please. As this slide illustrates, we started to see some of the problems of the worker shortage before COVID. And as I mentioned, COVID did exacerbate some of the aspects influencing the shortage, but it is not the cause. Main Street was covered with help wanted signs long before COVID hit. What we find now is the current status quo of how we recruit and retain workers is just not adequate. It's just not going to work any longer. Next slide, please. The way I stumbled into this space was through a conversation. The second month I was with the extension, someone who has since become a very good friend of mine, Dr. John Gall, asked the question, what is the extension doing about the crisis that opioids are causing with the workforce? And to be honest, we had not connected the dots between substance use disorder, opioid crisis, and its impact on the workforce. But that conversation got us thinking and got us looking and doing research. And this study was one of the first studies we found. It's out of Princeton, and it shows just one demographic in the workforce, the largest demographic in the workforce. Other demographics of the workforce have similar numbers. Basically speaking, at any given time, about 10% of the available workers are out of the workforce due to complications from substance use disorder. These numbers are not sustainable, folks. Next slide, please. The next study we ran across was from Penn State, and it shows this the outcomes of how much our communities are not receiving in tax revenue because those workers are out of the workforce. And what could our communities do if we could put that revenue back into their coffers? Became a present observation when we look at the impact in the workforce. Next slide, please. But it was this study that really haunted us the most. And this is a Missouri-specific study. The Missouri Hospital Association looked at the total cost the opioid crisis was having on our communities. And they went beyond the usual three being the cost of EMS, the cost of law enforcement, and the cost of incarceration. The opioid crisis goes well beyond those three issues and costs. This study drilled down and looked at the impact in the communities, like the impact of a two-income household becoming a one-income household, or maybe a no-income household. And not just the loss of those incomes not being available to our Main Street businesses, but the impact that children being raised in this environment have. The likelihood of them being able to get into jobs that require post-secondary education or training, or perhaps even the likelihood those children will even be able to finish high school. And what about the complications to those young adults as these children grow, but they didn't have access to preventative health care that they would normally get during their adolescent years because of some complications from substance use disorder? Is this kind of economic data and research that got us on the path that we're on? And then, like anything else, it was not a direct line path. Next slide, please. The United States incarcerates more of its population than any industrial nation, probably more than any nation in general. But like when you drop a pebble in a pond, the impact is not just the pebble, in this case, taking a worker and putting them in prison. It's the ripples that they cause that go unnoticed. Next slide, please. According to the U.S. Department of Justice, for every person incarcerated, the prison industrial complex hires 4 people to staff up that complex. So for every worker we take out of the workforce and put into prison, we take an additional 4 workers out of other aspects of the workforce to run the prison industrial complex. That's the ripple effect. Think about that for a moment. And it's not dissimilar when somebody leaves the workforce for substance use disorder. When they leave, it's not just them leaving the workforce, it's how many other people do they take out of the workforce to care for them or to work on their treatment program with them. That's the ripple effect. What if we could put those workers back into the workforce, the workers who are in recovery, the justice-involved workers who've served their time, put them back into the workforce. Not only are we adding them in, but we're also able to bring those workers who left the workforce to care for the substance use, family members perhaps, back to the workforce. And we can relocate workers from the prison industrial complex back into other aspects of the workforce. Next slide, please. In 2019 and 20, I had been recruited to work with Focus St. Louis on an impact fellowship. Focus St. Louis brought together a diverse group of community partners to look at the barriers to reemployment for people who are justice involved. My work group created this toolkit. It's an online toolkit to help better educate employers on the benefits of reemployment. And it also provide tools to justice involved workers on how to have conversations about their justice involved time during the interview process. Next slide, please. As well as working on that project, I learned of Dave's Killer Bread. If you're not familiar with Dave's Killer Bread, it's a great product. Check them out in the local grocery store in the bakery aisle. The photo on the right, sorry, was not a good photographer that day, but I retyped the text on the left. But this is their story. This is their story about being a second chance employer. It's a great story. Next slide, please. They put that previous note and this note on every loaf of bread they sell. When I was running across this story, when I was working on the Focus St. Louis project, I read about how before they created the Dave's Killer Bread line, the regional bakery was a big bakery, but it was a regional bakery. They created this line. They became a second chance employer, and they were growing. Ultimately, now they're a national distribution company. And some of their competition tried to hire their staff away. And in short, they couldn't pry those workers out of that bakery with a crowbar. The attitude from the workers were, where were you when I needed a job? These people treated me with dignity. They gave me a job with respect, and they gave me an affordable wage. Why would I jump ship now? This is what we call loyalty, people. Next slide, please. From that question, very early in my career, asked by a good friend of mine now, Dr. John Gall, a lot has been done since 2017. I don't have time to list all the people involved, all the steps we took, all the research that went into it, or all the projects that were accomplished along the way. But I'm very, very pleased to say that last October, we launched a recovery-friendly workplace initiative in Missouri. It's an online training and certification process that helps employers understand their role, stigma, and in particular, stigma around recovery, the importance that the understanding that stigma plays in reemploying or retaining employees who are either in recovery or in need of recovery, and how both employers and employees benefit from having that kind of supportive environment. Next slide, please. Since launching that program, these are just a few of the businesses that have adopted the curriculum, and we're working with more. This is a grant-funded program. It's small, doesn't have an advertising budget, but we're growing this program. Already we have signs of success. I want to share just a few of the stories that came out of this already. Citizens Memorial Hospital in Bolivar, Missouri. Within 2 weeks of the press release going out that talked about the Citizens Memorial Hospital becoming recovery friendly, they were able to fill, for the first time in a very long time, all of the positions in their nutrition and dietary department, which is where this program started. But they also filled all of the positions in their building maintenance and their landscape departments as well, which hadn't been done in a long time. And within that same 2-week period, they now have a waiting list of people who want to work at that hospital. They also learned that they had a number of employees who were in recovery, who now felt comfortable and safe talking about their journey with their employer. Ace Pipe is in Kansas City. They travel, I believe they said, a 9-state area, a huge geographic area across the Midwest, working in municipalities with sanitary and storm sewer maintenance and repair. It's a real challenge for them. They have a high turnover because of the amount of travel. And it's a real challenge for them when they have somebody in recovery. One of the things Ace Pipe did was they paired workers in recovery. They lean in to hiring people who are in recovery, being a second chance employer. And then they pair them on the same crews together. So when you're away from home, away from your family, away from your support structure, you have somebody on your crew who understands your journey, and you can be supportive of them and they can be supportive of you. This has helped Ace Pipe reduce some of their turnover rate and retain some of their employees. Tower Rock Stone, it's the largest quarry in Missouri. It's one of the largest quarries in the United States. Huge operation, big trucks, big equipment. Safety is paramount. And because of that, they track their safety and their training records very closely. They can tell you exactly how much it costs to train somebody up in both time and money to get them to the point of working accident-free. So as their safety coordinator said, this was not a liberal decision. This was a business decision. Plain and simple. Why would we throw away the money we invested in training this worker without first offering them a second chance? One of the examples they give is an employee who had been with the company for 20 years and could do anything in their operation and was often called upon to train people to do things within their operation. So why would they terminate his employment because of a drug test without first offering him the opportunity to come back after he went into a residential treatment plan? After all, they wouldn't be able to recruit somebody to replace him in the time that he was going to be out of the workplace. There's no way they could have, if they did recruit somebody, there's no way they could have trained them up in that period. So why not hold the position if the person wanted to come back to it for it after the treatment program? When Tower Rock Stone was going through this recovery-friendly designation, that worker celebrated their 25th year with the company and their 5th year sober. I believe he's still working there today. So as you see with these few stories and examples, second chance employment works once we get past the stigma associated with it. I am out of time and I need to turn it over to Lisa. Thank you all very much for your attention and for being here today. I look forward to any questions.
Dr. Swanson, thank you so much. That was incredibly inspiring. And I'll invite all of our presenters to come back on camera so that we can begin the question and answer period. I do want to say there's been so much that's been discussed, from the person in recovery to talking about what has happened at the state level and also within universities to address substance use and to build community capacity to address substance use disorder, and also what a state has done to engage employers. And I might suggest, Dr. Swanson, that success breeds success, right? You now have companies that are well respected that can serve as champions, essentially, for the programs that you are focusing on. So we do have some questions in the question and answer section, and I will go through those in a second here. But I so want to thank all of our presenters for their excellent presentations and for all of the work that they have done up to this point and will be doing after we are through today. So we couldn't do this work without you. I encourage all of you to put your questions into the Q&A. and also to look at the chat because there's contact information in there and also some resources that I think would be useful to all of you. So let's go ahead and get started. The first question is, I think for probably, well, could be for anyone, but have you seen success with jobs offering second and third shift work, allowing them to meet the requirements?
I can start us off, and then I have a feeling Doug will chime in. This question, I think, was posed while I was talking. I think that certainly being able to provide multiple time periods where folks can choose when would work best with their other requirements is ideal, of course. Certainly, though, there's always other factors that come into play, including things like childcare that people in recovery might not necessarily have in place already. And so I think having choice, like I said, is probably the ideal scenario. So people can think about those requirements that they have and be able to choose the shift that makes the most sense in their schedules. Of course, I mentioned one of the things that can pose a barrier is the requirements associated with seeking treatment using medication for opioid use disorder. Often clinics, opioid treatment programs that dispense methadone actually have very weird hours, like 5 a.m. to 11 a.m. is common. And so actually the requirements that people have to fit into their schedules aren't just things that are in the 9 to 5. 9 to 5 would be common for court, for meetings with probation officers, for drug tests, but there are also things that happen at other times in the day too. So that's part of why this becomes so tricky. It's not just that the 9 to 5 is incongruent; it's that other times are as well. So that's what I want to share. I'm sure that Doug or others have thoughts to add.
Thank you very much, Christina. That was very interesting and very helpful. Firsthand, we don't have any examples of second or third shift, but one of the events we had a speaker from one of the drug courts talking about their program and how it is utilized. And they told a story that might help answer this question. An employer had somebody who had hired somebody who was justice involved, great worker, but they're going to have to lose that worker for a half a day a week because of the time the worker would have to use mass transit to go over and meet with their PO, the parole officer. They wouldn't have time to get back and so the employer's like, why do I have to leave them for a half day for a 30 to 60 minute meeting? Long story short, the employer made a conference room available there at the work site so the PO could come on grounds and meet with that employee. So they only lost that employee for an hour. The employee didn't have to lose more pay. The employer got to keep more time. The PO got to meet on site. Ended up meeting the supervisor and other employer representatives. That employer went on to hire 3 additional people who are justice involved, and the courts coordinated their schedule so that there was the same PO dealing with all 4 employees, and they just scheduled all those meetings one afternoon, one after the other, and they used the conference room for a half hour a day. This is an example of thinking outside the box. What we've been doing since the 1990s for employment practices are going to have to change. The worker shortage is real. We no longer have the luxury of having employees out of the workforce who could otherwise be in just because we are trying to continue our employment practices that haven't changed in 30 or 40 years.
That's a fantastic story, Doug. And I want to add one thing, which is that often people who are justice involved themselves might not feel that they have the power, or indeed might not have the power to be able to ask for these kind of shifts themselves from the system. And so if a person can feel comfortable talking with their employer through these alternatives, and the employer can use their social capital and power to approach a judge, for example, like that's going to make a huge difference. Like having an active employer who is willing to support the person and who is willing to help, like actively create these solutions is really essential.
Correct. Acknowledging to the employees that they have a receptive ear is critical. Part of our designation process for recovery-friendly workplaces is having the employer develop a public statement, public policy that they share internally as with staff. It could be the same as what they share externally with the public, but they inform the employees that they're a recovery-friendly workplace, and they're going to be working with employees to help retain them or hire people who are in recovery. Having that public statement, provides the information to that especially to the newer hires, that this employer should be receptible. If the employee has a question, they should not be afraid to go to that employer and say, "Can we do something alternately than what we've been doing, so I can continue to stay employed here while meeting my other obligations that may be judicial or maybe medical as well."
So thank you both for those great responses to that question. Mr. Peak put something in the chat, and he also has a question. So why don't I turn things over to you, and you can then maybe encapsulate what you put into the chat and also ask your question. Thank you. Oh, I think you're muted.
There we go. Is that better?
Yes, thank you.
I'm from Indiana. Here in Indiana, we use certified peer recovery specialist. So if you don't know what that is, it's people in lived experience that get certified through the state of Indiana to work with other people that have substance use disorders. So our coaches use that lived experience as a way of meeting people where they're at. So I have a nonprofit that does peer recovery throughout our whole community in a rural area. And with our employers, what I put in the chat was that the state of Indiana is very proactive with the substance use disorder problem that we have. And they passed a bill, HEA 1007 into law, which is the Indiana Substance Use Treatment Law. And they provide guidelines to all employers and video toolkits for second chance programs, which was really, really neat. In our community, we work with our courts. We have 4 peer recovery specialists and a supervisor in our jail program. And then we also have 5 peer recovery specialists in our community and our local hospital. But with our courts working with parole, they'll do a referral to our peer recovery specialist with anyone that has a substance use disorder. And so it helps with their large caseloads where we can work with them, come up with a relapse recovery plan with them, meet them on the job or meet them on their job sites. Most of our employers in town work with us really well, or they'll let them come right off the line, not reduce their pay at all. They can meet for an hour. And then we'll report back to the probation officer. So the probation officer doesn't have to meet with them so often, because we can give a report to them. Hey, they met with us. They're doing well, and report back to the probation officer. The probation officer doesn't have to meet with them as often as they normally would. And then they do their regular monthly or every 3-month check-in. And so we work with the courts and the probation officer that way. And the peer recovery specialists get to kind of do more of the intermediate in between.
Mr. Peak, that is great. At the very beginning, when Dr. Brandt was talking, it seemed as if this was really a systemic issue. And the example that you've provided and also that Dr. Swanson provided is a great way to interject a process into that system that makes things work. So someone put into the chat, kudos to Indiana. And that's a great segue into our next question, which is for Dr. Brandt. Were you able to interview employers in your work, perhaps to hear about the ways in which they have experienced or how they have addressed the needs of those with opioid use disorder?
I have not personally interviewed employers. I think that Doug's presentation again shed a lot of light on this question. So thank you for sharing those stories, Doug. I think that one thing I want to add, I've seen very successful relationships between, for example, drug courts and employers, or treatment facilities and employers. Sometimes those kind of institutions can help broker connections that help employers figure out what they need to do to help this population succeed, but also for the side of the people seeking employment, kind of having someone else broker that connection can be very useful. That's also in a way kind of like a reference already when the program is backing you. So I think that seeing more of these kind of relationships grow between employers and treatment courts and employers and treatment facilities would be very beneficial for creating this pipeline that's beneficial both for individuals and for employers, right? Having that pipeline of people who are seeking employment, who are excited about succeeding in a job, going straight to an employer would be fabulous. Of course, as Doug said, also having like a public statement so that people who aren't coming from one of those institutions also know that you're a supportive employer would be beneficial as well. So that's what I want to add for now.
Thank you so much. And one of our participants also stressed that the scheduling conflicts between outpatient treatment requirements and employment opportunities seem like a major challenge. And so I think that we've been able to discuss some of the ways in which systems and employers have been able to make adjustments so that they can have recovery-friendly workplaces and can help with better navigating and balancing all of those demands that are present. And we also have a wonderful chat, which is from a woman who is saying that English is not something that she feels proficient in speaking, but she does understand it. And if there is someone who can help her, that would be great. So I think much of the information that's been provided will be helpful. And if anyone has an opportunity to reach out to her directly, her information is in the chat, and perhaps someone could connect with her. So we have two other questions that have been put into the Q&A. The next one is for Dr. Swanson. Do you offer individualized consultation with employers seeking to become second chance employers?
Yes, we do. The curriculum is all online, and so it can be done virtually. But when somebody goes to our website, an employer goes to our website and fills out the initial form, it goes to our project manager, Ann McCauley, and she works with them virtually in a one-on-one setting, as much time as they need. It's not a huge lift. It's not a very daunting task to go through the process, but they get a one-on-one with Ann, and then as they go through the process, they all have getting their statement. For some organizations, they need to have their mission statement around recovery friendly approved at their board level, et cetera. Or they're looking for examples, and they have somebody with our program who will do a one-on-one. We try to go out and do a public ceremony when we credential them. Part of that is, and so we'd be in person at their facility whenever possible. And part of that is to generate media around their proclamation of becoming recovery friendly. So initially up front, they get one-on-one with virtually, but eventually we do try to go out and meet with them in person and help generate some press in their media in their community, which helps with their recruitment goals. So I hope that answers the question.
I think it does. And if not, please let us know. We'll explore that a bit further. And one of the things, Dr. Swanson, that I think is really important is that you, coming from Extension, have put that information out there so that it is publicly available. And so, Ms. Constanza, for the work that you are doing with Extension in Lehigh County, which of course then extends out to the rest of the state, is that information available both within the state, but also available to other extension programs across the country?
The work that we're doing with connecting extension programming to recovery capital. Yes, and I would encourage any other extensions to replicate that model, to look at their programs and say, gee, this program really does increase social connection or increase the likelihood of recovery capital or provides people an opportunity to bond. You think like master gardeners. Those are fairly positive, healthy lifestyle people that, wow, if I can learn that skill and then connect with people who have this passion for gardening and growing things, what avenues that might open up for me personally or, career-wise. So, we're hoping that other extensions will take that perspective on their programs. So yes, please do. And like I said, most of our programs, many of them are virtual now, so people can, we're finding out people from all over are participating in our programs.
That's excellent. The resources that come from Extension across the country are just fantastic. So it's terrific that they are able to be used both across the individual states and also nationally. And so this is the next question is for Dr. Sterner. And while he is responding to that question, please feel free to put your question into the Q&A, or if you have materials that you would like to share, please put those in the chat. So, Dr. Sterner, are there grants or direct funding available through the Elevate PA program for local nonprofits or others working with individuals with opioid use disorder?
Happy to answer this question. And so this is why it's so important for us to understand the structure of the opioid settlement funding across the country. So we don't have any specifically through the Elevate Pennsylvania initiative, but what we're hoping to do is help others understand that most of these funds are going to be available to you through your local communities. So for example, if you're in Pennsylvania, the county commissioners have the ability to allocate those funds according to the plans that they've identified and needs within their communities. And so there are lots of opportunities in various counties to apply for microgrants or other types of funding available to, and specifically for not-for-profit organizations that are working to meet the needs of those with opioid use disorder. That's going to change if you're in a different state. So for example, in Delaware, all of that funding is available through a granting mechanism at the state level. And so what you'll want to do is make sure that you're aware of exactly how those funds are being allocated across your state. Typically, every state has a website attached to that. I'll also put in the chat a website that helps to monitor this across the entire country that has been a really great resource for those who are seeking to understand what is going on within their individual states. But there are lots of opportunities to utilize those funds, and those funds are going to continue to be dispensed over the course of the next 18 years. And so making sure that you're aware of what's going on now, as well as how it is that you can potentially impact those plans for the use of those funds moving forward is really important. One other note that I will make is that in Pennsylvania, we have state level funds. And so we have some of those funds that are being made through our Department of Drug and Alcohol programs. And one of the very key parts that they're hoping to increase access to is through workforce development for those in the behavioral health field. So if you are someone who is helping to support, for example, certified recovery specialists or certified family recovery specialists, and those types of educational certifications, there's opportunities for tuition reimbursement or scholarships, as well as other support mechanisms, even at the state level. And so we're really making sure that we're thinking about how it is that we can use this settlement funding as an inflection point for thinking about how we can maximize the use of these funds over the course of the next 18 years by connecting with local organizations and communities across Pennsylvania, but hopefully across the country.
Thank you so much. And we don't have any additional questions in the Q&A. We have about 5 to 7 minutes left before we turn things back to Philip. So let me just ask a question of all of the panelists, and please respond. This might be a nice time for a dialogue. So what we are seeing is that not only are individuals struggling significantly with substance use disorder, both either being bombarded with it if they haven't begun to use, or being very actively involved in using, or finding the challenges to live a life in recovery. We see that employers everywhere are looking for employees that they can bring in so that they can succeed in the work that their business is doing. And then we're seeing what this means for the overall economy of not only a community, but a state and also the nation. So let me ask you this question. Why do we need to fix this? And what are the ramifications of not doing it well? And we have 6 minutes in which to finish all of that so that at 11:30 we can have good.
I'll jump in and say all the data we're looking at is we have not hit bottom yet on the worker shortage. It's going to get worse. Since World War II, we've had a surplus of workers. It's not that businesses are doing anything wrong today. It's just that we have a different environment than we've had for the last 70 years. In World War II, to meet the production demands of the war machine, we finally let women into the workforce meaningfully, in heavy industry. We finally let, Mississippi hand farmers, which is workforce development code for Black workers, into workforce meaningfully. And then when the soldiers came home, those folks didn't leave the workforce, in significant numbers. And then we had the baby boomers. So we've had a surplus of labor for 70 years. Our practices just are not going to work as the workforce gets tighter. In recognition of Glenn's storytelling initiative, I tell the story about for the last 50 years, the workforce development folks have been able to walk into the produce section at the grocery store right after it opens, and there's these beautiful pyramids of gorgeous fruits and vegetables. And they could be selective and pick and choose and look for that perfect apple or peach or lemon or whatever. And that's worked because we've had a surplus. For 50 years, at the end of the day, you go back behind the grocery store, you can see that we threw out a lot of perfectly good fruits and vegetables. My mother used to make applesauce out of those apples. They were wonderful. The applesauce was great, even if they had a blemish on them. Well, folks, it's 10 minutes to closing time. The produce department's been picked over. Either you have to find a way to to overcome your biases, overcome your stigmas, or ultimately you're out of work or you're out of business because you don't have the workers. That's the story I tell.
Mm-hmm. Mm-hmm.
Yeah, thank you, Doug. And looking at it through my family resiliency lens, I know that financial stability is critical for optimal child development. Families have to be able to have an income to feed their children nutritious foods. They need to have access to high quality health care. We need to be able to buy the materials to support our children's education and development. And without employment, you can't do that. So I see it as so vital to family stability, now and going forward. And last Thursday, University of Missouri had a wonderful seminar, and a person said, when you say to an employer, about the recovery-friendly workplace model, a lot of them will say, well, I'm fully staffed. I don't have trouble getting employees. She said her comment is like, you're full of it, because you're always only half staffed. Half of your employees that you believe are sticking with you for eternity are looking for other jobs. People always, especially now, younger people don't have the commitment that they once did. They're very mobile and very very much looking out for their best interests. So you're only ever half staffed, even though on the surface it may not appear that way. So I think from that perspective, employers need to really think about this.
Well, and Denise, I think that your comment around making sure that we have an ecosystem that supports the healthy families and healthy communities is really important here. when we look at what got us to this place, it's not solely the access of prescription opioid painkillers that has fueled the opioid crisis. And as we look towards persistent unemployment, persistent inequality in particularly locations in Appalachia, in our rural spaces, those are the types of issues that we need to continue to focus on. Focusing on workforce development, focusing on retaining our workforce, focusing on recruiting individuals into our workforce and providing opportunities for their advancement and skill creation increases the capacity of our communities, right? It's not solely about your individual community, individual companies. It's about really thinking about how it is that we want to create healthy, sustainable, livable communities now and into the future. And if we're really serious about this, we need to be open to all types of individuals who want to be part of that vision. And frankly, the individuals who are in recovery and are working through their recovery process have just as much to lose, but also have just as much to gain as the rest of us in that process.
I know us, as far as the clients we deal with every day that are in active addiction, we really can't even start to work on their substance use disorder or their mental health disorder until we get their basic needs taken care of, because they're not even thinking about taking care of their disorder until they have basic needs taken care of. If they don't have housing, if they don't have stable housing, if they don't have stable food, if they don't have employment to take care of their basic needs, then we can't even talk to them about their substance use disorder, because they're using that as a way of coping with not having a job, of not having adequate food to supply their needs. So I know looking at those things every day, we have to prioritize those things first before we can even and get those things stable and get them to a stable place where they can even feel comfortable enough to even talk about, okay, now we've got you in a stable environment to where you can now feel comfortable enough to even talk about your substance use disorder. So it's looking at the person's whole needs, not just, okay, you have a substance use disorder, let's look at that. Well, if they're not in a stable environment, they're not even being well fed or have a place to lay their head at night, then we can't even deal with all those issues till we look at the whole person and every bit of their life and all the issues that they're dealing with and get to the bottom of why they use in the first place.
And that goes directly to Maslow's hierarchy of need that was talked about earlier, and the need to really flip that upside down. We need to begin to close things down, but I did want to say that there were a couple of things that were posted in the chat about whether or not there are organizations that are designated RFW. And if not, why not? With all due respect, we need to lead by example. And I think that Dr. Swanson's presentation really focused very well on that and how he can create a community of supporters that will sort of serve as touch points for others who might want to do that. Are there programs that are being offered in different languages, such as Spanish? And are there initiatives and employers who are offering affordable accommodations, including childcare, within the community to provide support? At our home institution here at Penn State, we do have daycare centers on campus, but they are open from 8 to 5, Monday through Friday. So for those who need additional childcare outside of those hours, that can be really challenging. So what I'd like to do now is to thank all of you for participating today. Our presenters were terrific, and all of their presentations meshed very, very nicely and provided a well-rounded understanding of recovery-friendly workplaces and what needs to be done. And we are so appreciative of the time and effort that you all have taken to participate today. So now I will say thank you again, and I will turn things over to Philip to close us out.
Thank you so much, Lisa, for moderating this very important and exceptional session for us today. We truly appreciate you taking the time to share your wealth of knowledge on the subject. All of our experts here, we appreciate you really helping us start to really think about this in a way, and hopefully, this can lead to more robust conversations down the line. So, and to our audience, Thank you all for joining us today. We value your presence and hope that these sessions are informative and provide value to your work. Thanks to our partners at Penn State Center for Community and Economic Development for collaborating on these assemblies. Ted, Christy, Justine, Alyssa, Jafar, thank you, and we appreciate you. I did drop in the chat there, the survey, so we're really eager to hear from you. We would love to hear about not only this session, but ideas about future sessions as well. And lastly, as just a friendly reminder, our next assembly, I think it was mentioned at the end here from Lisa around language. Our next assembly will be on the topic of welcoming immigrant workforces. So that will be occurring on September 27th next month. I hope that you guys enjoyed this conversation, and we thank you very much for attending, and we will see you then. Take care.